Eyewitness News is your vaccine authority, and as you would imagine, we have been getting a lot of questions about the Johnson & Johnson vaccine. And joining us live to get some answers this afternoon is Dr. Keja Amawako, Associate Professor of Biomedical Engineering at the University of New Haven. Doctor, thank you for joining us again this afternoon.
Thanks for having me, Mark.
A lot of new developments this week, and as I said, we have been getting a lot of questions. So I want to get right to one from Benjamin this afternoon from Willimantic. He is asking, I am currently on blood thinner medication due to a history of blood clots. I just got the vaccine on Tuesday. Should I be worried?
So generally speaking, blood thinners are good at preventing clots from forming, but there are some folks that when they take blood thinners, the drug can lead to medical conditions such as clotting. So if you have this history, I would suggest probably the J&J vaccine is not the right choice for you, because we now know that the AstraZeneca vaccine, which is similar to the J&J vaccine, has been linked to clots. So probably you want to get a different vaccine rather than the J&J vaccine.
Okay, good to keep in mind right there. Now, Lois is asking, if you have a noted blood clot in your body, should you get the vaccine?
So that's also a good question. You probably shouldn't get the J&J vaccine if you've noted a blood clot in your system. I think the best approach is you consult with your physician. Make sure that you probably, you don't go for J&J, you go for Moderna or the Pfizer BioNTech, because as I speak now, we do have a link between a similar vaccine, the AstraZeneca, a link between that and clotting. So you don't want to exacerbate the condition where you're going to develop multiple clots in your systems because of a history of clotting you have.
Better to err on the side of caution there.
Absolutely. You don't, because if you have a history of clotting and then you take a J&J vaccine, that can exacerbate the condition, that can put somebody in a case where they would develop maybe severe headaches because the clot is in the brain, shortness of breath because the clot has landed in the lung vasculature, or even pain in the leg because the clot has made its way all the way down to the vessels, blood vessels in the legs.
Our last question this afternoon comes from Barbara. She wants to know, what if you received the J&J vaccine a month ago and had no side effects? Are you in danger from it, and when does the clotting show up?
Yeah, so that's a very good question. You're probably not in danger from the J&J vaccine if you had it a month ago, because the data that is out there shows that these clot complications do surface within a couple of weeks. And it's very similar to the AstraZeneca vaccine too. The clots did show up within 16 days. So if you took it and a month has gone by, you're probably in the clear. But however, you would still want to make sure, monitor yourself if you're developing any headaches or shortness of breath or pain in the leg or even in your arms. You want to make sure you're on top of that and quickly reach out to your physician should any of these symptoms surface.
I don't mean to put you on the spot, doctor, but I'm curious, in your role, are you concerned about what's going on right now with this J&J shot?
I am a little bit concerned after learning that the AstraZeneca vaccine, which uses the adenoviral vector, just like the J&J vaccine, has now been clearly linked to clot formation in patients, and so probably after the data comes out with the J&J, some modification is going to be made in terms of who gets to receive that, if at all. But the good thing is we do have two equally effective vaccines out there, the Moderna and the Pfizer. So a little down-spirited with this news, but it's better to prevent bigger problems happening.
I would imagine for sure, especially in your role as a doctor. Dr. Keja Amawako, thank you so much again for joining us this afternoon. It's always good to see you.
Good to see you, Mark.